evening, everyone. We're going to call the meeting to order. Thank you to the public for coming out tonight to join us for this meeting today.
Jonathan Anna.
Present.
Ben Vitale.
Here.
Tom Winslow.
Present.
Bob Shea.
Present.
Hans Petcher.
Here.
Mark Strong is excused. Heidi Nightingale.
Present.
Elaine Daly.
Here.
Stephanie DeVito.
Here.
Brian Mudrow will be a little late. Aileen McNabb Coleman.
Present. Please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our sincere condolences to the families and friends of Marilyn Del Favaro, mother-in-law of former chairperson David Gould and mother of former security officer at the county office building Louis Del Favaro. And also Bill Cato, he's the former public health director and health and human services director and county legislator. So please take a moment of silence to honor them. Thank you. On our agenda this evening, we have a public hearing listed. After further review and discussion on the matter, the decision was made to have the project funded out of our capital reserve. So the public hearing is actually not necessary. So we don't have to enter into that. Everyone is aware. Move on to proclamations. I can be joined with Brenda Wyman. You can come on up. I have a proclamation this evening for and honoring Older Americans Month, May 2024. Whereas May is Older Americans Month, a time for us to recognize and honor Cayuga County older adults and their immense influence on every facet of American society. And whereas their wealth of life experience and wisdom, older adults guide our younger generations and carry forward abundant cultural and historical knowledge. And whereas older Americans improve our communities through intergenerational relationships, community service, civic engagement, and many other activities. And whereas communities benefit when people of all ages, abilities, and backgrounds have the opportunity to participate and live independently. And whereas Cayuga County must ensure that older Americans have the resources and support needed to stay involved in their communities, reflecting on our commitment to inclusivity and connectedness. And now, therefore, be it resolved that I, Aileen McNabb Coleman, Chair of the Cayuga County Legislature, do hereby proclaim May 2024 as Older Americans Month. This year's theme, Powered by Connection, emphasizes the profound impact of meaningful interactions and social connection on the well-being of older adults in our community. I call upon residents to join me in recognizing the contributions of our older citizens and promoting programs and activities that foster connection, inclusion, and support for all older adults.
Thank you very much. I'd like to thank Aileen and the legislature for this proclamation on behalf of the Office for the Aging, who sponsored this event. I'm on their advisory council, and I would just like to give a shout out and a plug in for Brenda and her wonderful staff. They do a tremendous job. It's not a very big office. I worked for the county for 33 years, so I have some experience. But also I wanted to let the legislature know that we always appreciate the support you do give to the Office for the Aging. And when Brenda comes forward, she truly, really needs something, and you've been wonderful in supporting that office. And thank you very much.
Thank you, Val.
It's wonderful to have an advisory committee chair like Bev. She's so supportive and knows just what to say, having been a county employee for so many years. So I'm going to ask her to stay up here with me because I have the honor and the privilege in the month of May to recognize outstanding senior citizens in Cayuga County. So we have 3 individuals with us here this evening and their families. So again, another year where our volunteers and their families have taken up one whole side of Cayuga. It's always special to see. So I'd like to start by asking Nelson Sullivan to come up. So I have just a few words to say about each person that's here. Nelson Sellover of Aurora, New York, is a Cayuga County native, a graduate of CCC and Mills College, and the Leadership Cayuga class of 1996. She has a son and daughter who are here tonight, plus 4 grandchildren and 2 great-grandchildren, one who is, she's. After graduation, Nelson started as a social worker for the Seneca County Nursing Home and then worked 10 years at the Cayuga County Nursing Home right after it opened, which I wasn't aware of. From there, she became the director of the Office for the Aging and led this agency until retiring in 2005. As director, Nelson served in multiple leadership roles, carrying out many new initiatives, improving services for older adults, including the earliest efforts to support the vital role of caregivers caring for elderly adults in our community. Nelson volunteered on the board of the New York State statewide Senior Action Council from 2005 to 2023 and remains active with this advocacy organization to this date. She volunteered with SCORE from 2006 to 2020. She's on the Boyle Senior Center, Inc. board, serving as chair since 2005. She's been a member of the Melrose Park Seniors since 2006 and has served on their leadership committee since 2014. She helped revitalize the Cayuga County Council of Senior Citizens and has been the vice president since 2023, serving as a valuable resource on the history and the current impact of this group, which includes holding an upcoming full-day conference right here in Auburn for our community on June 14th, bringing specialists to speak on scams and patient rights. Nelson has long been dedicated to the development and success of Bluefield Manor, the first non-subsidized senior living community of its kind in Cayuga County, and she continues to serve on its board of directors. She is an active member of St. Peter and John Episcopal Church here in Auburn, serving as a lay leader, chalice bearer, and past Sunday school and youth group leader and choir member. She is a past Girl Scout leader and Summer League girls softball coach. Nelson is widely known in our community for her friendly personality and giving spirit. She says that her guiding principle is faith, family, and friends. She encourages others to get involved, saying, "There are always opportunities God gives you to help other people." So for all of these reasons and more, we are recognizing Nelson Sellover as a 2024 Cayuga County Senior Citizen of the Year.
Thank you. I won't take too long. I've never been a person who acted alone, so it seems a little strange to be getting an award on my own, and I'm very appreciative of it, and I thank you all for it. But everything I do as a team. All the boards I'm on, it's teamwork. With the Melrose Park Seniors, it's a committee. We don't do the president and vice president format. It's a team. Everything, I can't think of anything I ever do by myself. And that even teamwork includes faith, family, and my family's here. They surprised me. I only thought my son and daughter were coming, and I so appreciate. And the other thing I want to say too, I've always lived in Cayuga County, and I've always lived out in the Union Springs area. And our sheriff, Brian Skank, is from Union Springs. I see other faces here from Union Springs. Bob Shea, who has up until this last year been my legislator and listened to me when I brought concerns to him regarding seniors. I've known Hans Pretcher for a long time. He was here when I was Director of Office for the Aging. And we reconnected when we were both taking care of our parents. And it's a wonderful community to grow up in because everybody cares about everybody else. And you know what? You can't walk into a store, and I bet this is true for most of you, where you don't know somebody you're stopping to talk to. And that's a great feeling of community. So you're really just helping out your neighbors and your friends. Thank you all so much. I appreciate it.
Madam Chairman, if I could.
Sure.
I just wanted to mention something about Nelsa. I happened to be on the legislature back in the day when she took over from Joan Gallo. Now, I don't know if anybody here knows Joan Gallo, but she was kind of a legend at the time. And everybody loved Joan. And when Nelsa came in, everyone was concerned that things weren't going to be quite as good as maybe with Joan. And in fact, she went on and she was not only good, she was great at the job. And everybody ended up really loving her and very thankful for all that she did. So I just wanted everybody to know that.
Right now, I'd like to call up Frank and Beverly Perkins, as well as their legislator, Jonathan Anna. Apologies, Hans. I misspoke and I didn't invite you up earlier. My apologies.
I'm not gonna hide behind a podium, Frank, so you might as well get up there. I'm not shy. That's right. So, you know, it's all right.
Right. Go right in front of me.
But right in front of
I'm
up here? All right.
Important folks here.
I'm Frank, she's Bev.
Thank you.
All right. So I'd like to introduce now Frank and Beverly Perkins of beautiful downtown Sterling, as Frank will tell you. Frank and Bev are lifelong residents of the Sterling area and have been married, I have a blank, how many years? 58. 58 years, thank you.
I'm only 150 years.
Attaboy, Frank.
They have 3 sons who are here today, 5 granddaughters, several who are here tonight. Frank has a long career as a meat cutter, working over 50 years in various markets in Oswego and Cayuga counties. The couple met while Frank was ignoring the meat counter and instead flirting with Bev, who worked in the front end as a cashier.
Made me a bad guy.
After they married, Bev was a homemaker and employed part-time at local businesses while raising their family. They were volunteers for their children's activities, including school activities, sports, and 4-H. They are now regulars at local craft shows where Frank displays his talented woodworking projects, and Bev's skillfully sewn items are very popular with the attendees. They attend Fairhaven Community Church and have been involved in the food pantry there for 6 years. Frank has been a dedicated supporter of the Sterling Nature Center since the beginning. He can tell you the story of how the center was almost another nuclear power plant, and he is proud of his role in securing this precious community resource for the wonderful park and recreation area that we now all have. Both Bev and Frank have been members of the Sterling Silver Seniors for 13 years. Frank is president for 11 years, and Bev serving as the trip coordinator, growing the club membership through their unique leadership style, with Frank as the funny but well-prepared frontman, and Bev doing the behind-the-scenes organizing, coordination, and paperwork. They're active members of the Cayuga County Council of Senior Citizens, with Frank elected president in 2023. Frank was a key partner in bringing the first COVID vaccine clinic for seniors to the Red Creek School in April 2021, where he, Bev, and other volunteers diligently served 999 attendees during a very long but very successful day. Frank attends multiple local area town and village meetings and is a tireless advocate and liaison for all things related to older adults in the community. And he was recently appointed to the advisory committee for our Office for the Aging. Bev says when we see a need, we help, and encourages others to get involved in their community. Frank adds, just do it. It's rewarding to get involved, and I've met a lot of nice people along the way. For all of these reasons and more, we are recognizing Frank and Beverly Perkins as 2024 Cayuga County Senior Citizens of the Year.
Right. You want to say, welcome to. Yeah.
It's hot.
Yeah, okay, it's a hot mic here. Okay. I got a little laryngitis and you guys are very fortunate. Ask some of these people back here, they know. Okay, I just want to say that Bev and I are just honored by getting this award. And Brenda called us a few weeks ago and I just couldn't believe it, you know. We do these things because we like doing it, working with our seniors. And I'll tell you, a lot of the cooperation, the reason I think why I'm here too, is because of the Office for the Aging. Brenda is, you call her and you get answers and results, and she's really helped our seniors. And not just our group, but all through the county. It's really great. And, you know, they're just, I could go on and on, but you guys don't want to hear me. But really, I do have two things that I say at the end of every meeting. And that is, I always thank the town and the village boards for what they do for our seniors. And then I give my Yankee report, which is very important to me anyways, okay? And that is tonight the game won't start until about 9:30, so we got lots of time. Okay. Now I'm going to turn over to Bev.
Yes, I would just want to thank our Sterling Town supervisors and our Fairhaven board for the money they give us so I can take our seniors on their trips. That makes me happy. Thank you for this.
Okay. Yeah.
On behalf of the legislature, we want to thank you for being here this evening, and also to bringing your families along. Thank you for being here to support your families and loved ones. Thank you to Nelsa and the Perkins for everything that you do. And I'm so glad that we had time to recognize you today. So thank you. At this point in the agenda, we have public to be heard. If anyone wishes to address the legislature, you may come to the podium. I don't know if anyone signed in or not, but. Yeah. Oh, you do? Okay. Thanks for coming. Thank you for being here. If you could just state your name and.
Karen Walter, 15 Case Avenue. Before my 3 minutes, I just want to say to Dave Dempsey, I interned under Joan Gallo when I was a student at Syracuse University. So yes, I do remember. I handed out a packet regarding the proposed homeless shelter. I don't know if you guys are as tired of hearing me or seeing me as I'm tired of showing up for meetings, but it's
I
all
thought you were gonna say
worthwhile.
you're tired of seeing us.
No.
That could be true too,
Yes,
though.
so-
Yeah.
Put together a little packet, and the first page is the Chapel House redevelopment timeframe that was presented to the county legislature on 11/8/21. And they executed their purchase contract on July 26th/22. So that's quite a ways down the timeframe. I was able to obtain a copy of the purchase offer, and that expired April 30th of this year. The project timeline, the next one that's in color, that was the timeline that is quite the same. But that's the one that they presented to the city council on 2/24/22. Just for a couple of highlights, the HHAP funding, if that is secured, that comes with a 25-year commitment. 25-year commitment. So my concern, I also attached some invoices. To date, they've been paid approximately $147,000 from the $250,000 that was allocated. And the concern that I have is that there was a resolution for $1 million of ARPA money to go towards an 82 emergency housing bed facility. And the site is really only for 80 beds. Now, you might say, what's 2 beds? But if I'm paying for 82, I want 82. And my concern is that this is getting so deep into the time frame that ARPA money, if it is not properly allocated and then properly dispersed, will be gone. $1 million gone. On the resolution for the $1 million, it also says to authorize a contract with Housing Visions. And to my the last foil that I did, that contract has not been executed. So again, I believe from last week's meeting, when we heard the finance committee, the members of that staff talk about our finances, and based on the lack of progress on these milestones, I would think and hope that the legislature would consider and take action to repeal that $1 million that was allocated. You've got a house here, your own building is in dire need of repair. You're looking at some financial problems in the upcoming years. And to be good stewards of our community and as elected officials and having a fiduciary responsibility, I sincerely hope that this will be not only considered, but acted upon appropriately and not in a rushed fashion as it was handled in the beginning. And I agreed with Wally the last time he was here on the one-on-one. The only other thing I wanted to quickly say, as long as I got a little bit of time, is, you don't know the question to ask until you know what the question to ask is. So with homelessness, when somebody goes into a shelter, they're continued to be counted as homeless until they're found permanent housing. So that's why the numbers keep running up. And that's a disservice. That's kind of a play, if you will. And it's unfortunate. The other thing is there's something called an unduplicated number. Who would know that there would be such a thing as a duplicated number and an unduplicated number? But until you get into the thick of it and actually review the documents, which I have done, and I will share with anyone, you don't even know that that's a question to ask. The last part of the packet are the number of people that are coming in from out of counties and out of state. And I believe the number, I don't have it in front of me, was 74% are county residents. They have a recent Cayuga County address, which would leave 26% as non-county. That's a huge burden on our resources, huge burden. And when we would hear and ask questions, it was, well, it varies. Well, we really don't have a good number. Well, we got some good numbers and they don't look good.
Could you wrap it up, please?
I will.
Thank you.
So again, please, with all sincerity, consider this request. Thank you.
Any other members of the public? Heard this evening? Or does any legislator have anyone to bring to the? I skipped over presentations. I see Shireen made me think of that too. So we actually have two presentations on the docket tonight prior to what we heard. And we're going to start with Monica Selvage. Monica is the project director, and she's going to talk to us about overdose trends and response in Cayuga County. Monica, thanks for being here.
Thank you, Madam Chair, for giving me some time tonight to update you and members of the legislature on the overdose trends that we're seeing in Cayuga County and how we responded as a community. I'm Monica Selvage. I'm the project director at Cayuga County Mental Health. I oversee the state-run, the state registered opioid overdose prevention program for Cayuga County Mental Health. And for the past 4+ years, I've been coordinating the countywide opioid response. If we look back, just a little bit of background, pre-pandemic, Cayuga County has had a high overdose fatality rate. And just 1 month into the shutdown of the pandemic in April of 2020, we already had lost as many people to overdose deaths as we had the prior whole year of 2018. So that was obviously a huge shock to us. We're a small community, a small county, and all those numbers are faces and people that we've lost and families that were shattered. So like most communities in this nation during the pandemic, we lost a lot of people. However, since then, we've been able to continually decrease overdoses in this county and overdose fatalities. For the first time in 2023, we've been able to get below pre-pandemic level, which is really something that not many communities see, and it's really defying the national trend. Do I have the clicker here?
Yes, you can use that.
All right, so I just wanted to show you what the trajectory looked like on the national level from 2019 all the way through the pandemic. So it continually went up. For 2023, for the first time, they're estimating that overdoses nationally are going down a little bit, but we were at the height of 111,000 people that we lost in this country. And in Cayuga County, on the other hand, since the height of the pandemic in 2020, we've been able to reduce overdose deaths by 65%. And that is really something that obviously we're happy about, and I'm going to go into a little bit later in how we responded and how we worked together to make this happen. But this is not the only thing we know. We don't just know how many people have died. We know when overdoses are happening, where they're happening, what the demographics are, what the substances are suspected to be. And all this data we're also sharing now with the public in our public-facing dashboard. And I invite you to check it out at your own leisure at cayugacounty.us/overdose data. And I just put some snapshots in there. You have that in your package. You can look at that on your own as well. And when you go to the top tabs there, you can actually search by time frame, by location. You can look for resources, all sorts of stuff. So this is all available to the public, and most of the data comes from data that has been provided by all 3 law enforcement agencies in the county who enter their data into the OD map, the overdose detection and mapping application. And we use that data probably every day for our response efforts, for trends that we're seeing, and we're really able with this local data to respond fairly quickly. And I'm bringing this up because we did not have this data 4+ years ago when I started. And so now we're really using this all the time, and it really helped us so much because before we had to rely on state data, which is greatly lagged, and we really don't care so much about what happened 2 years ago here in Cayuga County. We want to know what happened last week or last month, and now we do. So there's just some snapshots again that you can look at on your own. Here, just on the suspected substances, I want to mention that we're no longer seeing the traditional heroin when we're talking about opioids. We're seeing much more polysubstance use, meaning people have multiple substances in their system. Stimulants, cocaine is on the rise, and a lot of synthetic stuff. So basically things that are made in a lab where nobody really knows what's in it. And oftentimes it's mixed into regular drugs and people don't know what they're actually getting and what they're taking. A quick word on the resource mapping, and that's on the website too. You can see where we have resources located. And when you look at the far right, you see our treatment and recovery services, which are clearly located in Auburn alone. And when you look to the left, where we document or map out where we do Narcan trainings, it's literally throughout the county. And so when you see that we have our services mostly located in the city, it's a real hardship for people who are out in rural and outlying areas. So our outreach effort, having a presence in rural areas, showing people how to recognize an overdose, giving them Narcan, which is a nasal spray that can reverse an overdose, really has been a game changer for us and especially for people in rural areas. Here is a map that shows where overdoses are happening throughout the county. And so all those white dots were overdoses in 2023. I just want to say that in 2023, we had the fewest overdoses and the fewest fatalities in years. So if you look at different years, there might be more of those white spots. And so the idea is it's not just a city problem, it's really happening everywhere and in outlying areas. We also know from the data that we collect that if you overdose outside of Auburn, you're more likely to die. And that's obviously an issue for people who either have to wait longer, potentially for first responders. They might not have the resources there. They might not have access to other services that people in Auburn might have. So that's why we did a really big push for that rural outreach with a new grant that we got about 1.5 years ago to really meet the people where they are. And so we're going out to events in the communities there. We're going out to schools and businesses and anybody who really wants to let us in to have that conversation. It's really much more than just giving them Narcan and say, hey, this is how you can save a life, even though it's really important. It's more about reducing that stigma about substance use and having that discussion, especially in rural areas when we often think, no, it's not happening where I live, right? So since we've been doing this in 2020, when we started that really comprehensive Narcan distribution program all over, we've been able to cut the fatality rate in half. And that's really in the city and in rural areas. And that's really huge because, again, we weren't expecting that. We weren't looking for that. We just wanted it to go down. But again, with the data that we're able to collect now and that we have at our fingertips, we can see outcomes and we can measure outcomes now that we weren't able to do before. We also get data from our coroner's office. So if somebody passes away from an overdose and toxicology reports reveal what a person had in their system. So in a nutshell, almost everybody had more than one substance in their system. Almost every overdose that ended up fatal had opioids involved, and a big majority had fentanyl involved, which is a synthetic opioid. And what we're seeing, like I said before, stimulants are on the rise, cocaine, again, in combination with fentanyl, which is much more potent, much more deadly than, say, for instance, heroin, and then other synthetics that are being mixed into the drug supply. So for those of you who've been around for a while and remember the Healing Community Study, that was a project that ended in 2023, and it brought resources to our community, especially during the pandemic where we needed it the most. And it really laid the groundwork for us to start the countywide effort as it pertains to substance use. In that case, it was mostly around opioids. And so what that did for us, it helped us improve the countywide coordination and communications effort to the public, which is my job as the project director. We also were able to increase the data capabilities, like I said, and we're working with an epidemiologist, Dr. Corinna Noel out of Cornell. And she's been really behind putting that surveillance system together for us. All the reports that I'm able to provide, all the graphs and all those things come from that data. And so having that expertise in our county, because we would never be able to afford her full time, right? But having her a few hours every week to provide that expertise and that data surveillance system for us has been really crucial. Also, we've been working hard to reduce the stigma around substance use. People are more comfortable coming forward and seeking help and treatment. By going out to the media, by writing articles, by telling stories of local people who have recovered, and sort of shifting the public discourse around it. And we also provided agency training. So for staff of the agencies that we're working with, we have a nationally recognized consultant, Meg Rosa, who is working with all our agencies and providing technical assistance, providing trainings to help them implement the programs that we're working on. Because again, it's not enough to just say, hey, here's some money, let's fill this gap, let's do this program, and staff is like, we need help, right? So that's what he does. And so overall, we've been able to reduce overdose deaths through that effort. Again, a big part of that was increasing the Narcan access throughout the county. And our outreach coordinator, Jason Wally-Myers, through HELPRA, is really all over the place. He's placing Narcan boxes. He's checking them all the time. It's really quite the effort for one person to cover, you know, how big our county is and what the geography is like. But we don't want to have boxes out there and then be empty. So checking them, making sure that they are filled, making sure that everybody who has Narcan from us gets new Narcan if they've been using it. Is really important. And that helped us to the point where, again, the data that we get shows now that we're not just throwing Narcan out the window because we say we, you know, distributed thousands of Narcan, right? We have data now that shows that overdose witnesses are actually saving lives, which we did not see so much before we started that initiative. So since 2020, 141 lives have been saved by witnesses, so lay people, on top of the 115 lives that have been saved by first responders. And then we were also able to streamline the service and treatment access with our existing providers, but then also we were able to attract a new provider. Fund and Family Services out of Oswego has opened a new opioid treatment program. So now we have methadone in our community, which we have not had before, and people had to travel an hour plus every day to get that medication to treat the opioid use disorder. So how did we go about that? And I tried to figure out how to visualize that or how to talk about that, because I don't think it happens quite that way in other communities. And I think that's one of the reasons why we've seen the outcome that we've seen, because we have really embraced that the cross-sector collaboration to address this, right? It's not everybody doing the stuff on their own. It's really, we're sitting together at a table. Maybe sometimes there are conflicting interests, right, from agency to agency, but we're still figuring out how to work on this together. So on the county level, it looks like we have a local government unit, that's Cayuga County Mental Health. That's where I work. Under the Director of Community Services, Lauren Walsh, and then we report to the Community Services Board. And they, among other things, oversee all the substance use services in the county. And so on that level, that's really where the planning happens. the grant procurement. So if I write grants, I don't write it just for mental health because that's where I work. I write it for the county and in collaboration with the agencies who are actually going to do the work. So the agencies can actually focus on their work, right? So they don't have to spend hours and weeks writing their own grants and having to, and being pit against each other, right, for that limited funding that's available. So when we get that money, then we can provide the agencies with funding to do the work that they have the expertise to do. And so on the project level, it looks like, they don't have to deal with the grant administration, the reporting and all those kind of stuff. So I continue to do that with whoever the funder is. And I contract with the agencies, and then we're working on goals together. We're working on planning to implement those projects and also data that we want to collect to figure out, has that been impactful? And we also provide them with technical assistance. Again, the epidemiologist for data collection, the consultant for training for staff and whatnot. And that's all grant funded. So the county doesn't pay anything for that. That all comes through those different grants. And so what that allows us to do on the community level is we can continue that countywide coordination, that countywide data surveillance on a larger scale and not just agency by agency. And we can pivot our public education depending on what substances we're seeing emerging and continue harm reduction and stigma reduction activities. And so if somebody's in the grant world, nobody likes the word braided funding, but I just wanted to take a moment to talk to you guys about this because, we get a lot of grants in the county. And so what braided funding means is you get multiple funding streams to fund maybe one person or one program. And what that does is you have a lot of conflicting interests because every funder might want a different focus for that program or different spending or reporting requirements. And that creates an administrative burden to administer all those grants. And so when you look, it's probably better in your packet, but when you look here with all the lines that you see, those are all different grants that I've administered at different times. And the circles there show that at any given time, there are like 3, sometimes 4 grants that coincide that fund one particular program. And so what that means is, like, to me locally, I want to know how one program is doing. I want to know how the Narcan program is doing. But since I have 3 different funding streams, I write 3 different budgets, 3 different reports on top of the stuff that I actually want to know locally. And then grants run out. So then that creates that unpredictability because you don't want to create another gap. You don't want to stop services or programs that have been really impactful. So you're chasing some other grant elsewhere. And on that note, the last line is actually brand new. We just received an award last week from the State Department of Health for $600,000 to help people who are homeless and suffer from substance use disorders. So again, there we're working with our Department of Social Services, the Emergency Shelter Program, and the Street Outreach Program for homeless to provide intensive case management for people who are currently unsheltered. So that adds to the other 4 grants that we're currently working on. So, and that's what it basically looks like then in terms of the programming, and I'm not going to go through all that. I just want to say that the new grant that we're working under now, I was able to secure about 2 years ago, a diversion grant, basically helping people with substance use disorder, divert them from the criminal justice and the child welfare system towards recovery and treatment. So basically prioritizing treatment and recovery over the system per se. And so there we work really closely with peers, specifically with Nick's Right, to embed them in our child protective service divisions and the foster care divisions with the goal to keep families together or bring them together if they've lost their children already. Same with the opioid court, when people are being arrested, we're embedding peers right there so they can make a connection right after that first arraignment. On the other end of the spectrum, when people are being released from jail, we also want to make sure that there's peer support there for reintegration because they're at very high risk. And then we've used some opioid settlement funds to either create some new programs where we've seen a gap throughout the years or expand some programs that have greater needs. So for instance, we're working with CHAIR to expand the prevention activities in schools, in rural areas, and also in the city of Auburn. We're working with Nick's Ride for Friends for peer support at the hospital, which is a really important intersection. We're working with the Cayuga Community Health Network on a pilot project for transitional housing. And with the Cayuga Counseling Services, they have a program that helps children who are affected by parental substance use. And they have a wait list. So with an additional therapist, they can help kids. So those are some of the projects that we're working on now to continue to address gaps that we are seeing through the data or through the agencies that we're working with. And again, on the slideshow, there's some more information in there on those new projects. For the future, again, we want to look at what emerging substances are we seeing, what are other communities seeing, because chances are it might come to us. How are we prepared for that? What are we gonna, how are we gonna address this? Recovery housing is always going to be an issue, and we're looking to address that on different levels. We're also waiting for a grant award that would allow us to do a countywide prevention plan, which is something that we currently don't have and would be really important to pursue. And then we're also looking at co-occurring diseases. If a person has mental health and substance use disorders, and how can we integrate care to address the whole person and not just one at a time? So that's it. Are there any questions?
Monica, you said was, how many people saved based on Narcan?
141 by witnesses and 115 by first responders since 2020.
So on the 115 were through the Narcan as well, correct?
All of them through Narcan. But the difference is the one is by lay people, right, who just happened to be at an overdose. And then the others were by first responders when they were called to an overdose.
I want to personally thank you for getting Narcan out there in this very thorough report. People are honored to save maybe one life, but if you can track 100+ lives that do the Narcan, it shows that your work is really effective. So I want to personally.
I'm sorry, it's just a credit to you that you continue to get funding that comes into this community from multiple sources to keep all of these initiatives going. So that I just wanted to mention that that's a great credit to you and, gratitude from this community.
Monica, I just want to say thank you. It's encouraging to see the numbers come down as some of the tragic results, both people overdoses. But I have a question about the data.
Mm-hmm.
Your data collection, is that done by first responders at scenes, hospital transportations? How do you collect the data you have? Is it, especially on the outskirts of the county where people are being maybe transported by an outside county agency to an outside county hospital? How do you account for those?
So in general, all our 3 law enforcement agencies in the county, when 911 is called and they show up, they report those cases into it's a national data system. And then our epidemiologists can get the data from there and run reports. It's probably not we're not capturing probably everything because like you said, because of county lines and hospitals and whatnot, where it becomes tricky is especially with fatalities, because we go by what we get in our reports, from what law enforcement is reporting. However, and I have it on every slide that it's conditional because we still don't have all the data from the toxicology from the people who passed away. So if somebody passes away from a Cayuga County resident in another county, that might not show up in the data that we have.
You have to overdose occurred within the county.
Well, if you overdose in the county, yes,
we're going to know it's in the county.
yeah.
Yes, that's my point. If it occurs in the county, we're going to know it's in the county, regardless if they get transported outside.
Right, but in the end, we reconcile when we get the final data from the coroner's office, and usually it's 1 or 2 a year that we're missing that way or that we learn after the fact. And then we reconcile that data when we get it.
Any other questions for Monica? Thank you very much for this information. Thanks for being here today. Up next for presentations, we have our Operations Officer, Shireen Andrasco. Talk to us about compliance.
Good evening, everyone. Evening. This material is very important. However, it's not very exciting. So I just want to let you know. But I am present today to provide to you, the legislature, the annual training and awareness on the Cayuga County Compliance Plan. Why am I doing this? Well, I am the county's compliance officer, and I work with the team to oversee the program and its requirements. And training on and awareness of the plan is one of them. So here I am. Am I going to do the clicker thing?
I can, whatever you want.
Okay, no, I'll try it. All right, let's see if it works. If not, I might need your help.
Yeah, I got you.
I've got you. Thank you. So the Cayuga County Corporate Compliance Plan, you can find it on the county webpage, the website. Please review it in its entirety at your leisure. What I'm going to do today is basically provide you some knowledge of the key components of the plan. There are no current updates to the plan right now. But let me start off. Let me give some of you some background on the information on the plan. Some of you may not be aware, but the county does provide medical and health related services and receives payments from Medicare, Medicaid, some third-party insurers. These services are provided by the Public Health Department, by Mental Health, and they're known as the covered departments under the plan. So the Corporate Compliance Plan provides a program to ensure that the quality services that are provided and that are reimbursed by Medicaid fully conform to all the applicable state, federal laws, along with the New York State healthcare programs regulations that are given by Medicaid and Medicare. Corporate means throughout the county government. So what is the plan's purpose? Well, basically to prevent, detect, and respond. This includes some steps for internal auditing, for prevention and detection, along with the reporting structure, which reduces a potential for fraud and abuse through self-correction and self-reporting of errors. All of this and continual training assists staff with adhering to the laws and regulations while conducting these services in the highest ethical manner. So moving on, as just stated, part of the plan requirements is to provide you this annual training or awareness. And it goes to the Cayuga County Board of Health as well as you, the full legislature. So what are the objectives of training? Well, we want you to know and understand what is non-compliance, what is fraud, what is abuse, all this relative to a financial setting. We also want to review some key components of the compliance plan, which can include how do we respond to and handle the required reporting of compliance complaints or some issues. And we want you to also know the right reporting. So how to report non-compliance and that there's no retaliation and there's no intimidation. There is protection for that. So to review the options to report, and we also want to review the options, for reporting non-compliance. But just keep in mind, some of the goals of the compliance program are basically to improve quality and efficiency and remain consistent with our services. We also want to demonstrate a strong commitment to integrity and ethical behavior, as well as identify areas of risk. And we want to make sure that we're communicating all this consistently. So we'll start with non-compliance. When we say non-compliance, what is that? Well, it's any conduct that doesn't comply with those laws or regulations or county policies or practices, local laws. It could be the pay or program requirements. But conduct that basically fails to meet the standards required by a particular law or a rule or regulation or policy is non-compliance. So next is fraud. And it's a definition in a financial setting, and it pertains to the corporate compliance plan. So it's intentional deception, misrepresentation made with the knowledge that deception could result in an unauthorized benefit to a provider or an individual. The act of a person who knowingly makes a false statement, representation, or deliberately conceals material or facts, or impersonation or other fraudulent device. So in a county governmental setting, it is very low risk to find an individual who intentionally defrauds Medicaid, but mistakes can be made. They can occur. Bills can be found that don't have appropriate backup and are in error, but they are corrected. And we have a process for that. The county is obligated to review and identify and correct all errors, and we have to do that in a timely fashion. And of course, failure to do so, and once it's discovered, is deemed knowingly to submit a fraudulent claim. So just some fraud examples. If you submit a false claim, you offer payment or acceptance of bribes, kickbacks, or gratuities. You can falsify some billing records. You may make false statements. And then, of course, overall theft. So what is abuse? That's also part of the compliance plan. These are practices that are inconsistent with sound fiscal, business, medical, or professional practices, which result in unnecessary costs to the medical assistance program. It could be payments for services which were not necessary or rendered. And then, of course, payments for services which failed to meet recognized standards for the actual healthcare. So some abuse examples: a therapist who improperly bills for services that are not actually provided or supported by any documentation of the sessions conducted. That's abuse. A therapist who does not bill for services within the regulated specified period following these services. And this, of course, relates to the healthcare program regulations for Medicaid and Medicare. So what are some consequences of noncompliance? Well, sanctions can be imposed and individually. So that could include, as a result, some possible mandatory training or retraining. It could be an oral warning, or it could be a disciplinary action, which could result to termination. Sanctions can also be imposed against the county for failure to identify or remedy or mitigate false claims activities. Fraudulent activity can have criminal, it can also have civil consequences. But this is why we have our corporate compliance plan, to reduce the risks of these incidents or sanctions per se. So reporting noncompliance under our plan. Who is responsible for reporting noncompliance? Everyone. Employees, vendors, business associates, county legislators, Board of Health members. Personnel are required to report fraud, waste, abuse, any improper conduct internally. So the county creates and maintains a direct line of communication between all involved in the compliance program: the compliance officer, the committee members, and of course, the legislature. So again, when everyone is working together in the program, this helps prevent against identified risks, and it enforces the policies. So we talked about the compliance committee. This is also in our compliance program. Who is on the committee? Compliance officer, the covered department's compliance officers, and depending on if there are situations, it may include a county attorney or the chairperson of the legislature. The compliance committee assists with the program and plans to keep us on track. How do they do that? For prevention, they identify areas of risk through regular meetings with the covered departments, and they report on their compliance activities. So our meetings are quarterly, and we use a planned agenda, and we follow an annual work plan. And this work plan basically lists out all the areas in the program that are reviewed regularly. So basically, it's another part to keep us on track. So detect and report. Report detected potential non-compliance. So the covered departments, they handle the reporting within their departments. And They report to the compliance officer and then, of course, to the committee. And detection is could be through internal audits, or someone coming to them. But it's handled by the covered departments themselves. And then, of course, correction, we initiate correction plans when non-compliance is detected. We mitigate and eliminate risk. We reduce, eliminate fraud and waste and abuse, and potentially save money. And that's why we have compliance procedures that are within the plan. So it just basically encompasses that: prevent, detect, report, and correct. So next is the non-retaliation and non-intimidation. There is assurance that there's no retaliation and intimidation when reports of non-compliance are made or received. Any individual who reports a compliance concern in good faith is protected. We have whistleblower protections. There are federal, state regulations. You're protected against discharge, demotion, suspension, threats, harassment, and other discrimination. But that's just the assurance and the awareness that there is no retaliation or intimidation. So we may ask ourselves, well, how to report noncompliance? Well, noncompliance can actually be found internally through the audit process, but you can also report directly to a department head or supervisor or a covered department compliance officer, and the compliance officers are listed for you. They're through mental health as well as the public health department. They are also part of the committee. You can also report to the county compliance officer, and there's a number. There's also, we have a county compliance hotline, which is anonymous, and that's basically for the public. And it could be by employee as well. And then, of course, the reporting can be done directly through the Office of Inspector General Compliance Hotline, and we provide that number as well. So this is something that we show on our display board throughout the departments, as well as it's located on the webpage. But this allows the communication to everyone how they can report noncompliance. So in summary, the corporate compliance plan provides an administrative framework for addressing these areas that are most likely to present a compliance risk. It includes procedures to assure the county and its covered departments remain compliant with all federal and state laws, rules, and regulations. It also includes reference to program guidelines that are provided by the Office of the Medicaid Inspector General. So please understand that as an elected official or an employee of the county, you are required to understand that, one, we have a plan, that you understand what the plan represents and the standards within it, and that you agree to abide by it. So just to conclude, the cooperation and participation of all the covered persons within our corporate compliance plan ensures that the county still maintains a high level of competence and ethical behavior in the delivery and the billing of their services. So that does conclude the annual training. I didn't want to take up too much of your time. I know that you've had some other presentations, but you can feel free to contact me personally or the other members of our corporate compliance program if you have any questions that may arise. Thank you.
Thank you.
Now your annual training is all done.
Thank you. Okay, we're going to move on to minutes to approve. 23rd, 2024.
Second.
Yep. Any discussion on those minutes? All in favor?
Aye.
Any opposed? Very, thank you. You have appointments and reappointments listed here below. There is a resolution at the end of the agenda that will all-inclusive passage of these appointments and reappointments. There are no communications and announcements. We do have Cayuga Community College President, Dr. Durant, here today. Thank you for joining us.
Great to be back.
His report.
Good evening, everyone. Good to be with you. as we realized as we were sitting here earlier, that we're still in the month of May. Feels like the longest month year thus far for us at the college, but a good one. We had our opportunities to celebrate students in our nurse pinning ceremony, and certainly our commencement exercise just a couple of weeks ago. I want to thank the chair for your time and your remarks for our graduates. Certainly always important for us to be able to have our sponsor represented, to be able to be some of the first to congratulate our students as they reach such an amazing achievement. Over the last several months, working with certainly our trustees, Trustee Nightingale among them, we've been working on developing the college's operating budget that we'll be looking forward to get their approval at our next meeting in 2 weeks, and then be looking to move that ahead for you. And this year, as in recent years, I'll be just planting to see today that I'll be asking for a 1.5% increase for our sponsoring support for the college. That'll be approximately $38,000 or $40,000 or so. But, it certainly is something that is necessary. When we do our presentation for our budget, we'll talk about the strides we've made into continuing to monitor our finances, live within our means, build our base for our, certainly related to our fund balance, while also trying to be mindful of investments and positioning the institution the best way possible for our future, both as a community and certainly as an institution. I think one of the other things I wanted to comment on today, and came from there before, and the rain's going to keep me away from after this meeting, but this week, as I'm sure many of you have read and have heard, we're hosting the national championship for junior college baseball at Falcon Park. It's something we sought after and were awarded. And it wasn't just for us to be able to say that we're the host, because actually there's lots of work that people have put into it, certainly great expenses that go into it, that we're partnering with to recoup. But it was also, I think, another moment of part of the promise that I gave the legislature at the time, and with our partners at the city and many others, our trustees, about how partnering and being able to create an asset that would be year round, a little weatherproof, that we've been able to see for a number of years now when it comes to Falcon Park, that it wasn't just about the college. And, this week, being able to sponsor, put the work on, 8 teams from across the country, I think 2 from Texas, Massachusetts, Illinois, New Jersey, and so on. 1 from New York, Herkimer. They came to Cayuga County and to Auburn, and hundreds of student athletes getting hotel rooms, eating at restaurants, families here to be able to be parting it for really an event that came in and started on Friday, and will be going through at least to tomorrow, if not Thursday to conclude. Bringing in not only revenue for the community, but also to being able to showcase our community in a way to others that may not have ever been here. So, I always want to just thank you as supporters of the institution, and certainly people who, challenged us with our rationale, why the investment would be important short-term for student athletes, but also being able to see a bigger picture of community asset. And I hope many of you have been able to take advantage of, what that park has been able to do in many different moments throughout the year, serving high school students and other colleges, and certainly the double days and other concerts and, clips viewings and so on, countless moments. And, I just want to also take a moment publicly and just thank our partners in the city for being able to provide this opportunity for us. And we know it was a shared service project here years ago, and that also helped made it possible. And it's something that we're very proud of. And I'm also very grateful for the work of the college community to be able to help pull off an event like this, and the work that they do on a routine and regular basis. On the capital facility side update, hopefully you can continue to see the progress on the Workforce Development Center. It still continues to be on pace for an opening later on this summer. And our police academy on our Fulton campus is making great progress as well, with a hopeful opening again later on this summer for that facility on our Fulton campus. Many of our partners in law enforcement regionally are already utilizing it for professional development, and utilizing the campus for professional development. And we are really excited about the innovation that we're going to be able to work through from a curricular perspective in the coming years, to be able to leverage, the graduates, if you will, from the academy, for those to be possible college credits if they're still in need of an associate's degree, while also being able to provide a unique opportunity for students who are not within the academy that are already hired, but that are within our criminal justice programs to be able to take some of the aspect of the academy while in college that will position them not only better potentially if they get hired to be able to get through the process quicker, to be able to get out to work, but also to be able to really get exposure to a career field and to meet other people interested to see if this is really for them. And I think that's an exciting thing as an educator. The more often we can get young people connected with you all as mentors and leaders within your industries and fields to be able to see what it really is rather than what you think. That makes a great deal of difference, which is why, my last update really is that we continue to make great strides in developing our pathways and programs with our K-12 partners. We've already met with district leaders this year, rolling out one of our strategic initiatives about aligning several pathways that are going to be really providing a basis of a couple of different things. The first one, of course, is to be able to show students and families as early as 8th and 9th grade that choices that they're making about college classes, Cayuga classes, while they're in their respective high schools, how those courses align with degree requirements, and that they're creating value for themselves along their journey through high school, both in a dual credit way and putting them at an advantage to potentially save themselves money later on, and also to be able to get exposure to more diverse curriculum while they're in high school, which really does help some of our smaller rural districts because otherwise those offerings would not be able to be there for them. Second piece that we've been able to secure this year with our partners of our College Foundation is a new scholarship program that we're going to be rolling out as early as this fall. And the scholarship program builds upon the idea, right, of that value of the dual credit opportunity in earning college credit. And for us at the institution, we are being able to set up certain milestones to encourage high school students to earn. If you earn, 6 or more credits, it's going to come with a certain level of automatic scholarship if you enroll at Cayuga. And if you enroll 12 or more credits, it's going to result in another level of automatic scholarship to Cayuga. It's a tremendous opportunity that our foundation is helping to support the institution, our trustees doing. And those are just the building blocks for where we're moving next, which is I'm hopeful with our partners in K-12 over the next couple of years, we're going to be able to roll out several opportunities that be able to put students in a position to potentially be able to graduate high school with, at least 50% of their college degree completed, aligned with a pathway with a scholarship to Cayuga that is going to also have articulation and several partnerships with robust 4-year school offerings so people can potentially put themselves in a position or a 3-year accelerated bachelor's degree with many, many partners. And that way, it's not just about trying to accelerate people to the workforce, because trust me, as someone who decided to graduate the first round of college too quickly just to work forever, it's not about that. But what it is about is making sure that individuals, when they choose to take courses, that they can continue to gain the confidence in themselves academically and the skill sets that are critical to be able to put themselves in a position that their readiness for college, whenever it may be, is going to be much stronger. That's what the research says. So it's not just about gaining enrollment while they're in high school and challenging and being able to rush students. That may be an aspect for the right learner. But what I can tell you is the more college credits someone has beneath them or below them already, the more likely they will persist while they're in college and while they're moving ahead. And if we can do our job as a community to be able to increase those that want to go to higher education, to increase their likelihood of success and completion, that helps everyone. And it certainly helps the college meet its mission and certainly our vision. So we have many other strategic priorities that we're focused on right now in the areas of student success, holistic advisement, and we certainly continue to look at our infrastructure related to what we offer and what we deliver online versus on each of our respective campuses as we sort of reset our master schedule, if you will, in a post-pandemic world as we try to rebuild it. So more to come on all those details. And I know that operationally, it may not seem as important as the big stuff, but I want to diversify my talk every month, but then just about finances and facilities, because the great work and the strength of the college really comes down to what we're really supposed to be doing, which is teaching and learning. And if we're focused on that, that helps our reputation, that helps strengthen the success of our students, and that certainly puts us in the position that we want to be, which is continue to be the premier institution that we can be. Be happy to answer any questions.
Any questions for Dr. Durant?
Trustee, great.
Really a comment. I wanted to say that by being present at the recent graduation, I was re-struck because I have worked on the campus before, but I was re-struck by the magnanimity of having a truly premier, robust college in a small community like this. Something that maybe we take for granted. We don't see it in our travels in the county, but it's something we should be paying attention to for a lot of the reasons that you listed.
Appreciate that.
Just another comment, Dr. Durant. I appreciate a lot of your comments. What you're kind of looking for the future, and it's really very self-satisfying for me, being a school board member, that our strategic plan at Fort Byron is almost mirrors what you're talking about too. So I think there's a great future for young folks in Cayuga County in so many different ways.
Yeah.
And really appreciate the comments.
Any other comments or questions? Dr. Durant, thank you very much.
Thank you all.
Appreciate
Have a
it.
great day.
Up next on the agenda, committee reports or individual legislative reports. Anyone have anything to report on this evening? We'll start with Heidi. Legislator
I
Nightingale.
just have a few comments that I'd like to remind the legislature about or inform them of. On June 2nd at the Owasco Pavilion is the volunteer recognition for the Office of Aging volunteers. They really drive, those volunteers, hundreds of them, actually drive what happens through our Office of Aging. And if you haven't signed up yet to attend that, it may be a little late to do so, but I'm sure if you give Brenda a call, she would appreciate that. The volunteers definitely appreciate seeing the legislature, the legislators there. I also wanted to let people know another event to put on their calendars. Nick's Ride is having sort of stories of recovery and a celebration on June 8th from 11 to 3:30. There'll be food trucks and raffles, but the really moving part for all of us may be indeed those stories of the peers that we are hearing about when we are in committees and we hear a lot of reports. We heard about our peers today through Monica's report, and those whom the peers have. I wanted to give an update that I have made a trip through the college's renovation of the old Cornell Cooperative Extension building for our county workforce development, and would want to let you know that I took some photos and I didn't think of putting them on a thumb drive so we could get them up here. But this is truly state of the art what the college is providing at no extra rental cost for us. There are state of the art classrooms. There are offices which provide such comfort for our employees and the potential workers, those looking for work development or looking for work to come in a environment of real dignity. When you walk into that main foyer, it's all glass and a large, double, triple sort of ceiling of light. That's the feeling one gets is a sense of lightness. And that's what occurred to me when people are maybe at their worst, having lost a job or being discouraged about where they're at with employment. They're going to be walking into a place of real light, and our employees are as well. And looking forward to that ribbon cutting and the reality that we really will get there now in late August. Finally, I wanted to give you some update on the Youth Bureau ARPA monies. They have been distributed. The $250,000 that we allocated have been distributed. And we have been able to, with that money, support programs from the north to the south of the county, including athletics, mentoring, STEM activities, literacy building. And I particularly want to mention, because Legislature Strong is not here today, and he was a key player in getting attention to the Youth Bureau around the skeet shooting club range. Their allocation has almost been all spent, and they're nearly completed with the renovations and the upgrades of that skeet shooting range. And that, I don't know if you call it play, it's not play, that the skeet shooting tournaments or are happening, and everybody's very excited about the upgrades and changes there. So just a few things happening in various committees and programs.
Thank you. Legislator Daley?
Yep. As you and I spoke today, to sort of give a summation of the budget update that we got at Ways and Means, and we certainly did get information from Grace and Lynn about, as planned, they came to our May meeting. They are going to be coming back again in July with some additional information for 2024. We looked at how the 23 budget performed and got a snapshot of some of our 24 mandated accounts. We did get not a lot of information, and, you know, some of it, again, I'm the naysayer, some of it quite concerning. At the end of 23, our fund balance sits at just over 17 million after taking into account this over 7 million we used for our operating budget. The year before, they pointed out the fund balance was at just over 25 million. Sales tax growth for 24 appears to be flat, although our budget predicted a 3% increase over last year. So we're going to be looking closely at how our sales tax is performing, because we certainly don't want to come under our budget amount. We did get an early look at a number of our mandated accounts, and the ones they pointed out seem to be trending over budget. So, you know, I believe unless we want to continue to look at spending down our fund balance, we will unfortunately need to find ways to reduce spending in this budget and budgets beyond. I think as a group, we could come up with some possible strategies of how we might accomplish this, and then we'll have to come to agreement on what those might be. But more information to follow and more of an update in July after half the year is over.
Thank you very much. One of the points you made was this current budget year. I think one of the things you're maybe trying to convey too is the fact that what departments had in their budgets coming into this year cannot be replicated for next year, and also concerned about potentially fully spending down that budget that they have this year. And this is something that we need to department heads have discussed further, and you know, they need to start to think about some strategies for themselves. They certainly don't want the 11 of us to come up with those strategies. And I'm not insinuating that. I just think, though, that they probably may be able to potentially begin to think about places that they can make some changes. Thank you. Any other legislative reports or committee reports? Okay, I'm going to move on to my report. I have a few items to add, and some projects are ongoing. First, I want to begin with devastating news we received earlier this month that Wells College is closing. I do want to take a moment. I'm happy to see Kelly King here today, and to say thank you to you in person. And I appreciate that Kelly and her team were right on site there, willing to lend a hand to get people organized apply for unemployment and in order to access job fairs and access everything that they need to during this time. This came as certainly as a big surprise, not only to the families of students, but as well as the community and the workforce. So I have attended many meetings with the mayor of Aurora, with the region, and at the state level as well concerning Wells College. So it's been all hands on deck about future there. The building roof repair will be taking place this summer. We are still working through the particulars, but refer to emails for updates in the coming days. There will be, during this process, there will be a crane parked out back when the time comes. There may also potentially be abbreviated or changed hours of certain departments. We will communicate all of this to the public and employees when the time comes. So rest assured, we will be proactive in this time. I had the honor, as mentioned before, of attending and speaking at Cayuga Community College commencement at Falcon Park on May 15th. I am also a alum of CCC. So I was very thrilled and proud to attend that event and see the graduates and to watch them receive their diplomas, to see the relief on their faces. And in my words, you know, I tried to plant the seed so that they could think about their new world as it opens up in front of them and to try to carve out place in their lives for public service, as you all have here. So I'm hopeful that may have planted a seed maybe in that group. So I mentioned running for local office as an idea, but we'll see. I had the opportunity to meet Senator Chuck Schumer at Nucor last week. And I also had the opportunity to speak there to thank him for his efforts. He is trying to highlight fair trade practices in order to save American-made materials and goods and also to protect American jobs. So I appreciated the fact, excuse me, that he was in Auburn at our Nucor Steel location and that we are so proud to be the home of Nucor here. So I was really excited for that. It has been a very busy month. I am pleased to announce, as we did announce last week, we're ready to embark on a new economic development vehicle for Cayuga County. I want to thank everyone in this room for having the conversations that we did have surrounding this. The Cayuga County Development Corporation will serve as an umbrella to economic development. There will be much more on this as we move forward, but we're very excited about the future of Cayuga County. We're really excited to shore up whatever we need for our businesses to set up shop here, to continue working here, and to expand and grow, and also hopefully impact families, the future of our county. So I'm really excited about it. The Downtown Revitalization Initiative for the villages of Cayuga, Union Springs, and Aurora is in full swing. I'm continuing to serve as co-chair with the village mayors. I have a pretty intense schedule with that, and I'm really excited to be a part of it. And the last time I addressed you was on the eve of the opening of the Sterling Nature Center. I was really, it's too bad that I couldn't catch Perkins before they left, but the fact that, you know, this place was going to be, you know, part of a nuclear site.
Site at one time and a dump,
And it's
a waste dump at another time.
exactly. And the fact that the Friends of Sterling Nature Center came together and saved this site. And now the county owns acreage here, and now we are finally establishing such a beautiful educational center. So I have some pictures to show you from that day. So here is the center as you arrive to walk into it. They have this beautiful blue door. They really put a lot of thought into this. There's the roof. As one part of it looks out toward Lake Ontario and the other part looks out toward the pond here, which I forgot the name of the pond, but it's very, very scenic and beautiful. Here's the inside, and you can sort of make out from the floors to the walls to the ceiling. Every detail has been just very thorough and very well thought out. And it's very impressive. I was really, really excited to be there. And they have some examples and samples of wildlife here. We had almost 300 people at the opening, and I don't think that the organizers were expecting that many. It was very impressive. I was excited. Is there any more? That's it. So if you get a chance, please take a ride up there. Mr. Winslow has been the last legislator to be up there recently, right, this past weekend?
Past weekend, yes.
And what do you think?
That was very nice.
Well, there you go. There's an endorsement. I thought it was very nice. I want to thank Doug Del Stritto, Minette Becker, Jim D'Angelo, and all of the park staff for the work to ready the site for opening day. I'm hoping to hold our September meeting with Sterling Nature Center. So I'm really excited about that. So we will get more details as we get closer.
Is that
So,
our September meeting?
Yeah.
Held up there?
yes,
That'd be cool.
that'd be nice. We'll carpool. It'll be fun. Okay, does anyone have any questions for me before we move on to the resolutions? Oh, sorry. I do have one more thing. I'm so sorry. If I could have Heidi Nightingale, please come up front.
God,
Forgive me.
kind of trouble to get into.
I'm just trying to figure out before she gets up there. You can't.
Yeah. Did I get into?
So I want to present, if you all remember the year that, or the day of this year that we were sworn into office for our reorganization meeting, Heidi was able to offer a selection of poetry for us in order to commemorate the day. And so we have that now printed and framed, and it will be hung here in chambers. So I wanted to present you with how it appears, and we will place
How
it on the
lovely.
wall today. So I want to thank you.
The birds that stay in our county.
Exactly. So, let's do together. Would you like to?
Sure.
Thanks. Right now. Yep. Amanda's got it, 'cause she's tall. That's good.
There it goes. Awesome, Heidi.
Awesome.
I have had some broadsides placed here and there, including around this county and cricket. But this is the most humbling and amazing spot for me as a poet to have one of my poems produced as a broadside placed in the chambers of our county.
Yay.
Thank you.
No, we didn't.
None. Wow, good secret.
Awesome. All right, now to our resolutions. So we'll start with Ways and Means with Legislator Daley.
Ways and Means had 6 resolutions this month. 4 of them belong to real property. WM 1, 4, 5, and 6 were reassessment of the Coles property, authorizing the county treasurer to pay a mortgage tax, authorizing the purchase of tax foreclosed property owned by Cayuga County to previous owners, and 6 is authorizing the correction of errors in the town of Sempronius. I ask for a motion for 1, 4, 5, and 6.
Second.
Okay.
Any discussion on the bundle? All in favor?
Aye.
Any opposed?
WM2 is authorization to enter into a contract with Catapult Executive Consulting to conduct a compensation study of Cayuga County non-bargaining full-time positions. And WM3 is authorizing the chair of the legislature to enter into an agreement with USI Insurance Services for the provision of health insurance consulting services. And that's a continuation of those services.
I'll make a motion.
Second.
Okay, any discussion on the bundle? Hearing none, all in favor?
Aye.
Aye.
Any opposed?
I'm opposed to number 2, for the same reason I gave last time it came up, which is we have more administrative staff than we ever had before in the county's history, and we still can't do it in-house. This is ridiculous. It's a waste of taxpayers' money.
Thank you.
And put me on the record against number 3 also.
Oh, guess number 3?
No speech.
Thank you. Noted. Noted, yes. Okay, thank you, Legislator Daley. All right, up next, Health and Human Services, Legislator Nightingale.
Madam Chairwoman, Health and Human Services had 7 resolutions. I'd like to go through them essentially one by one. HH1 is authorizing the chair of the legislature and the public health director to enter into a multi-year agreement. This is 5 years with the New York State Department of Health to participate in youth tobacco and enforcement and prevention program and accept what will be 100% state funding.
Okay, can we get a motion on HH1?
Make motion.
Second?
I'll second.
All right, any discussion on this? Hearing none, all in favor?
Right.
Opposed? Carried, thank you.
HH2 authorizes the public health director to create and fill a junior accountant position. Like other departments over the past year, we've been looking at titles. We've also been looking at recruitment and retention trends. And right now, we have a supervising billing specialist position. And it is vacant. And in looking at the reality of those, the duties, this went through civil service and personnel committee to find that the more appropriate title, and that's where it's create, is junior accountant position. We've done this with several other departments, and we've also found that we have a better recruitment rate when people see that title rather than the sort of more antiquated and not specific and not accurate title of supervising billing specialist. There is no change in grade. It is budget neutral. And upon acceptance, the supervising billing specialist position will be abolished.
Okay, great. Can we get a motion?
Second. Was there a first motion?
I'll make the first.
First, second?
All right, first.
Awesome. Any discussion?
I have a question.
Yes.
And I brought this up in the committee. The last resolve states that the position 87676 will be abolished upon successful completion. However, the resolve above it still states that the position has an automatic fill behind. I'm under the impression that there was no fill behind. Is that correct, or am I misunderstanding the resolution? Because I thought the resolution, I didn't think there was any position to fill behind due to the budget neutral and the position that we were creating a position. We're just shuffling one over and abolishing one that we're able to move back. Confused by the automatic fill behind.
Kathleen Cuddy is on the remote. She may have more accurate information. What I'm going to say is that there isn't fill behind when we abolish the position. But what will happen is there's going to be an internal, there's a promotion, internal promotion that will be filling the junior accountant position.
So we're creating a position to fill, and then that leaves a vacancy to fill? That's what I didn't think there was.
That would probably be the fill behind, but if Kathleen is.
My understanding was this was a position neutral resolution from committee. That's why when I read it yesterday again, I was surprised to see that the automatic fill behind was there still.
Can I say something? I had asked too at Ways and Means or prior to.
Right.
And this particular incumbent that's in the supervising billing specialist is going to move into the Director of Administrative Services. There's a retirement coming in June. So she's gonna take that particular job, right?
Okay,
And
so
instead of filling,
of the
yes, she's gonna,
the retirement.
yep. So
Okay.
once she retires, she's gonna take that job, and the job that they're going to fill is a junior accountant.
Okay, that makes more sense. I understand. It's okay.
So it's an internal candidate that's the billing specialist who's going to bump up and have the higher job.
Gotcha. Okay, so that's how it remains. Yeah.
Thank you.
Thank you for
Yeah.
being more clear than I could be.
It's all right.
Okay, any other questions or discussion on this? All in favor?
Aye.
Any opposed? That's carried. Thank you. Next step.
HH3 authorizes the chair of the legislature and the public health director to enter into a 2-year contract with the New York State Homes and Community Renewal to participate in Leading with Lead grant and accept those funds associated with the grant from May 1st, 24 through March 31st, 26. We've heard a lot about lead in our county, lead in our older home stock. So this is a critical program, also 100% funded.
Move it. Second.
Discussion. All in favor?
Aye.
Any opposed? Carried.
HH4 authorizes the chair of the legislature and the commissioner of social services to enter into a contract with the Rescue Mission for homeless and family and traditional housing. This is something, this is a contract that we have utilized for several years now with good results, something that the department chair the department chair is happy with and would like to renew the contract.
Motion.
Second.
Discussion. All in favor?
Aye.
Any opposed? That's carried. Thank you.
I would like to bundle HH5 and HH6. Both of these are traditional fills in the mental health department, one a full coding and billing specialist, one a senior clerk position.
I'll make motion. Okay, second on the bundle.
Second.
Okay, any questions or discussion? All in favor?
Aye.
Any opposed?
HH7, I could have included in the bundle, but I like to pull that out. This is a budgeted social work staff position. Again, we see that word create, and that is because we are using the CMH help program to allow the potential social worker to come on board without taking the civil service exam. It's still a budgeted position, but we have to change the title through the help program or indicate it as a help programmed staff social worker.
Right.
We've done this successfully in many departments. It's helped us again with recruitment.
Awesome. Thank you. Any discussion on this? All in favor?
Aye.
Any opposed? That's carried. Thank you. Thank you. All right, government operations, the legislator, Muldrow.
Thank you, Madam Chair. We have 6 resolutions. GO1 authorizing increase the salary of deputy county clerk 2 within the county clerk's office. Can I get a motion?
I'll make a motion. Second?
A second.
Okay, discussion. All in favor?
Aye.
Any opposed? That's carried. Thank you.
GO2 is fixing the day of notice of public hearing on local law authorizing the sale of county property located at B Street Road. Can I get a motion for GO2?
Nightingale.
Second. Discussion? All in favor?
Aye.
Any opposed? Carried.
Madam Chair, GO3 was pulled. GO4 is authorizing the chair, legislator, and the chief information officer to accept a grant for the New York State Division of Homeland Security Emergency Service called DASH. I get a motion for that.
Yep.
Second. Okay, discussion.
Wait a second.
All in favor?
Aye.
Any opposed? Carried. Thank you.
Okay, GO5 has been tabled. And so we're gonna move on to GO6. Fixing the day of notice public hearing of local law number for the New York, for the year 2024 local amendment law of number 4 for 2024 local law authorizing video conference for public hearing meeting to continue the authorization of video conference public hearing for 2 years until July 1st, 2026.
Motion.
I'll move that.
A second. Discussion on this? All in favor?
Aye.
Thank you.
All right, carried, thank you. Planning and Public Works, Legislator Vitale.
Madam Chair, Planning and Public Works has 5 resolutions. Number 1 has been pulled and replaced with number 5 most recently, but I'd like to bundle 2, 3, and 4. Basically, it's fixing date for the public hearing for the Ag District. Number 3 is for a planning position because of resignation, and number 4 is continuation of an agreement with the Oswego Valley ATV Club, which we've been doing for years, so.
Second.
Right, discussion. All in favor?
Aye.
Carried.
PPW 5 is kind of the updated resolution. Basically authorizing the agreement for the bid on roof on this building. We do need a 2/3 vote. We do not need a public hearing. So I'd be looking for a resolution, then hopefully a 2/3 vote.
Make a motion.
Second.
Any discussion?
But this will cover the entire cost of the roof repair, and we'll be able to afford it out of this new account that had,
Oh, yes.
okay,
And plus there's a built-in 10% contingency, I believe.
in case it goes over. Yep.
Okay, any other discussion? All in favor?
Aye.
Any opposed? That carried, thank you. Great, JPS with Legislator Anna.
Thank you, Madam Chair. Judicial and Public Safety has 10 resolutions tonight. JP 1, 2, 3, and 10 of the Emergency Office Management. I'd like to offer them as a bundle. JP 1 authorizes the Chair of the Legislature to sign a contract with New York State Indigent Legal Services. I'm sorry, that's not what it's EOM. I'm going to still bundle it. JP 2 authorizes the Chair of the Legislature of Cayuga County to serve and direct a grant, Homeland Security grant for fiscal 21 and accept funds. JP 3 authorizes the Chair of the Legislature to accept funds from the Department of Homeland Security for fiscal year 2022 as far as the hazardous materials grant. And JP 10 authorizes the Chair of the Legislature and Cayuga County EMS Director to accept New York State Division of Homeland Security funds for fiscal year 23 to 24 for the hazardous material emergency preparedness grant.
Second. Okay, discussion on this bundle. All in favor?
Aye.
Madam Chair, I'd like to offer JP 4, 5, and 6 as a bundle. Files the Sheriff's Office. JP 4 authorizes the Cayuga County Sheriff's Office and Weedport Central School District for the placement of full-time SRO or Special Patrol Officer within the school district. This is fully reimbursed by Weedsport and does not count the county of Cayuga any money. JP 5 authorizes the sheriff to fill 1 vacancy of a licensed practical nurse within the custody division of the jail. And JP 6 authorizes the Chair of the Cayuga County Legislature and the sheriff to amend the agreement with Nick's Ride to increase the rate for peer support. It's amending resolution number 164-23. And, okay.
Second.
Discussion on this bundle. All in favor?
Aye.
Madam Chair, JP 7, 8, and 9 involve the DWI program, Stop DWI program. JP 7 authorizes the chairperson of the legislature and the Cayuga County Stop DWI coordinator to enter an agreement with Auburn Double Days for advertising during the 2024 season. JP 8 authorizes the Cayuga County Legislature Chair to enter into an agreement with Auburn Police, the county sheriffs, the county probation department, and the DA's office for a budgetary appropriation of 3 years of Stop DWI funds. And JP 9 authorizes the disbursement of planned annual appropriations to Cayuga County Schools after prom event for the 23-24 Stop DWI program.
Okay, can we get a motion? Second. Discussion on this bundle.
Just regarding the after prom. Did we decide prom season has
So these,
figuring out, so did we allocate in advance?
so yes, ma'am.
So they can, they'll
These
they
funds
paid
were
and
allocated ahead of time. This was supposed to be done earlier.
Right.
Here, Zink was a little behind schedule with it. This is a resolution that next year will be brought forward during the winter and not wait till late spring. But those funds, this is basically reimbursing now for those funds that were dispersed. It's my understanding from Seneca.
Got it. Thank you.
Great, thank you. All in favor?
Aye.
Opposed? Carried. Thank you. We'll move on to ledge resolution. So we have two tonight. Ledge one is authorizing appointments to boards and agencies that are listed on the front of your agenda. Any discussion on these? All in favor?
Aye.
Great. And then ledge two is to appoint new superintendent of buildings and grounds. As it states in the resolution, a vacancy will occur on July 19th. Drew Duckett enjoying retirement. And we have to vote on his replacement.
Move it.
Second. Any discussion? All in favor?
Aye.
That's carried. Thank you. I'm going to do something a little bit different. We are going to adjourn and then we are going to stick together. We have a topic of discussion to seek legal counsel about. So we can do that not in an executive session, rather we can just adjourn. There will be no more business and we will seek our legal counsel with our counsel. Can we get a motion to adjourn? Motion.
Okay.
All right. All in favor?
Aye.
All right, let's adjourn. And then we'll come back in this room in about 5 minutes and we'll have our legal service.